Imaging relates to radiology-based investigation. So we have X-rays, which can be of the relevant body part like chest, abdomen, limbs, and skull. The CT scan is generally a quicker test, though it involves radiation exposure. It's good for imaging the skeleton, and it can pick up bleed in the brain as well. It can be used for specific areas like looking at the sinuses. It can be looking at the abdomen. Visceral trauma can be picked up as well. Contrast studies are used for gastrointestinal, renal, and vascular systems like angiography, for example. And in gastrointestinal tract, you have a barium swallow or a gastrographin swallow to see if there is any obstruction. Magnetic resonance imaging or MRI involves no radiation. It's quite a good test for imaging structure. So structural detail of the brain or the lungs and other organs can be clearly looked at. And MRI takes time. It's in a cold environment, so the patient may need to be sedated sometimes if they are agitated, especially children. And you also have radioisotope studies where you use a gamma camera after you inject radioisotope material. So it can focus in specific areas like technetium scans, and you get iodine scans looking at the thyroid tissue, for example. And you can also do a skeletal survey, which may show you either signs of systemic infection localizing in the bone, or it can be metastasis from a cancer which has spread to the bone, and so on. You also have specific procedures which may involve biopsy of different parts. It may be a swelling, it can be a lung biopsy, it can be a liver biopsy, and as I said, you can do a bone marrow aspiration, which is a type of biopsy as well. Lymph nodes can be sampled, and all of these are studied by histopathology, which is a lab study looking at these tissues.